I would like to introduce Amy Whitcomb-Slemmer, the Executive Director of Healthcare for All.
Good afternoon. Thank you, Joel, for that lovely introduction and for setting us up for a wonderful celebration of the 5th anniversary of health reform in Massachusetts. 5 years ago tomorrow, these and others of you in the room who I'm sure I'll get to recognize in a bit, along with Governor Romney, made history when we moved to guarantee health care for everyone in the Commonwealth. Today, we're still working together, along with Governor Patrick, to protect the incredible success of our law by moving to contain health care costs and ensure the quality of the care that we deliver to the people of Massachusetts. When Massachusetts set out to ensure everyone in the Commonwealth, we set an ambitious goal for ourselves. And like any lofty goal, it took time to achieve. Universal health care coverage took years of work and a whole lot of political will to make it a reality. And today, we can boast 98% of coverage for all adults in the Commonwealth. We have so much to celebrate, and we're grateful to our state leaders, past and present, for their continuing commitment to this landmark law. Last month marked the anniversary of another landmark piece of legislation, the Affordable Care Act, which was signed into law by President Obama. And what was the blueprint for this historic national landmark legislation? Massachusetts health reform. Our work, our collaboration, our commitment has led to healthier outcomes not only for Massachusetts, but also for all Americans who will be enjoying the benefits of more affordable and accessible health care. It's my privilege to introduce Secretary JudyAnn.
Thank you, Amy. It's a real pleasure to be here this afternoon. I need not say, how many people in Mass, what percent are covered by insurance? 98%. One of our goals, we know that 99% of kids are covered. We estimate there are about 32,000 children without insurance in Massachusetts. My goal is to get all 32,000 of those kids. We have great opportunity in Massachusetts and across the country to think about how we can keep on this journey with the implementation of the Affordable Care Act, and we plan to take advantage of every provision in that act to build on the wonderful foundation that we have in Massachusetts. So when I think about what this day means to me, it's with great pride that I am here standing before you today. It's with great pride that I see the leaders in Massachusetts, ranging from the Jack Connors of the world to the Senate President, to the Rick Lords, to all the people who took a chance on the first connector board, Celia, everybody who's up here work together to make this happen, and that is what makes Massachusetts such a special place. I want to thank you for making this anniversary possible and for giving us such a wonderful thing to celebrate on this Monday. Thank you.
This is not about policy alone. It's about people. It's about what kind of Commonwealth we are and want to be. I met a young woman a couple of years ago who described to me how, at I think just about 29 years old, and no health insurance, she discovered a lump on her breast. She was able to get insurance because of brand new programs put in place by the then brand new connector. And she got access to an affordable, high-quality physician who helped her deal with breast cancer. She is alive today because of healthcare reform. I am proud of healthcare reform. I am proud that we are the kind of Commonwealth that values health as a public good. And I'm so proud. I'm so proud of all of you who came together to make this a reality. And it makes me proud that 98 plus, you said 98%, it's actually more than 98%, it's 98.4% of our residents have health insurance today. 99.8% of children, no other state in America can touch that. And you did that. You stuck with it. You envisioned it and you reached for it. Because you understand that we are all in this together, and that it is above all a statement of who we are as a Commonwealth. Now the next big challenge looms. A challenge that faces the whole country. It's not unique to Massachusetts. It's not even particularly aggravated in Massachusetts, and that is how do we contain costs. And just as we have been a model for the whole nation on how to expand coverage to everybody, I believe it will be here by people reaching across all kinds of differences, where we will show how to crack the code on costs. And I look forward to working with all of you, those who stand with me here, and those of you here, and those you represent, to bring that new triumph to our Commonwealth as well. Thank you all for having me.
In many ways, our connector has been the focal point for the implementation of Chapter 58. And as other states begin to set up their own exchanges, it is truly one of my pleasures to be able to talk about the experience we've had here in Massachusetts. I'm proud to introduce our leader of the connector, who's working hard day in and day out, linking Massachusetts residents with health care and truly making implementation of Chapter 58 a success and a reality for thousands of people across the Commonwealth. It's my pleasure to introduce Executive Director Glen Shor.
I want to thank everyone in this room for getting us to where we are today, a state with virtually every one of its residents insured. In 2006, you took a gamble on a bold experiment to expand health coverage, while the rest of the nation was mired in debating competing versions of perfect solutions. That's courage. And you stuck with it through implementation. That's commitment. Governor Patrick, your actions have set a tone of yes we can, yes we will. Even the worst economic downturn since the Great Depression didn't shake your commitment to reform. Thank you.
Thank you very much. I'm pleased and honored to be speaking here at the 5th anniversary of the Massachusetts healthcare legislation. In October of 2006, through the Assistance in Healthcare for All, I was fortunate enough to be the first person enrolled in Massachusetts' new healthcare coverage. And up until that time, I had struggled for 10 years with unexpected and mysterious health problems that left me unable to work, forced me to abandon my graduate work, and exhausted all my resources and retirement funds that I had been working to save up for so long. And the hardest thing was losing my health insurance and the access to the health resources to try to regain my health. Nobody plans to get sick, but it happens. In October of 2006, all that changed. For the first time, I was able to seek out doctors and health care that would help me get well. I no longer lived in fear that each day a new health problem or an accident would make things even worse. A society cannot be healthy if its citizens are not healthy. I hope that the millions of people in the United States who still need coverage for themselves and their children will benefit as I have from the right to adequate health care. Thank you.